What? Good evening from New York. All of that in exchange for one Republican vote. Our fifth story in the countdown, Senator Snowe of Maine today becoming the lone Republican on the Senate Finance Committee to cross party lines to vote for what is essentially the Baucus bill. The Baucus bill that was essentially the insurance industry bill that the insurance industry trashed anyway yesterday with a phony research study conducted by accountants who today distanced themselves from what the insurers did with the already cooked books. The only thing that would have been more fitting than for Senator Snowe to vote for it was if there had been a Senator Bull to have done so. In anticlimactic fashion, the Finance Committee today approving its $829 billion health care bill by a final vote of 14-9. Ms. Snowe making it clear that her yes vote today might not still be a yes vote when the final legislation comes to the floor of the Senate.
So is this bill all that I would want? Far from it. Is it all that it can be? No. But when history calls, history calls. And I happen to think that the consequences of inaction dictate the urgency of Congress to take every opportunity to demonstrate its capacity to solve the monumental issues of our time. Finally, I say that my vote today is my vote today. It doesn't forecast what my vote will be tomorrow.
Thanks. The Finance Committee's work winning the praise of the president, who singled out Senator Snowe in his remarks.
And I want to particularly thank Senator Olympia Snowe for both the political courage and the seriousness of purpose that she's demonstrated throughout this process. Now, this bill is not perfect, and we have a lot of difficult work ahead of us. There's still significant details and disagreements to be worked out over the next several weeks as the 5 separate bills from the Senate and the House are merged into one proposal. But I do believe the work of the Senate Finance Committee has brought us significantly closer to achieving the core objectives I laid out early in September.
Meantime, the folks at TalkingPointsMemo.com having received a copy of the health insurance lobby's secret memo that it is distributing to local insurance agents across the country. In it, the AHIP offering several arguments against what it calls a government-run plan, including that under a public plan, patients' choices and access to health care will suffer, as if it isn't already suffering for those with private insurance, let alone those with no insurance. Yesterday, the AHIP, so you know what AH stands for, having tried to deep six all reform altogether by releasing a faulty study on the eve of the Senate finance vote that confirmed health care premiums will continue to rise with or without the Baucus bill, and that the current reforms being proposed do not do enough to contain costs. They are the companies that would be raising the premiums. They are the lobbyists who helped to write the Baucus bill. Ahead of today's vote, Senator Kerry taking apart both the report and the insurance cartel which funded it.
It's a powerful argument for the attitude of an industry towards this effort. There's an old saying that if you're not part of the solution, you're part of the problem. The fact is the Price-Waterhouse analysis is significantly flawed, and the results are simply not valid. PricewaterhouseCoopers admits that it has not taken many of the reform provisions put in this legislation into consideration. How do you put out a study that doesn't take what the benefits of the reforms will be?
Conservative Democrats on the Finance Committee long having argued against the public argument by a public plan that would not be able to reach 60 votes in the Senate. This afternoon, one of those Democrats, Senator Conrad, coming up with a new reason to be against it.
Public option tied to Medicare levels of reimbursement is a non-starter for me because I represent North Dakota.
Lots to talk about tonight with Senator Ron Wyden, Democrat of Oregon and a member of the Finance Committee. Thanks again for your time tonight, Senator.
Thank you, Keith.
In previewing your vote on the Finance Committee bill during the debate this afternoon, you said you would be voting yes, and quoting you, to move this legislation forward. What do you believe needs to still be done to this legislation as it moves forward?
Keith, we've got to do a lot more to hold the insurance lobby accountable, and that means choice. It means public choices. It means private choices. What we learned today is that under the bill, 7 years in, more than 90% of the American people wouldn't have real choices at the exchanges. That's just unacceptable, and we're going to stay at it until we turn the tables on the insurance industry. I'm
missing something about the courtship of Senator Snowe, as nice as it is to see some support for the whole concept of this coming from the other side of the aisle. At best, materially, she supports a trigger for a public option, such as what you just described. Is her vote supposed to be the start of some sort of mass seeing of the light by Republicans or the more conservative Democrats? Or is there any insight you can offer to me as to the strategy behind this?
I hope it will. The bottom line is the American people are going to insist on reform that holds their premiums down. What we learned again today is that this legislation doesn't do that. I talked about people who are making about $66,000 a year. They're going to pay something like 20% of their income on health care. That's going to be unacceptable. What we've got to do is make sure that the insurance lobby sees that there are real choices. With choice, you get more competition. That makes coverage more affordable. We've got a lot of stages in this process to go at it, and we're going to take on the status quo caucus, which is led by the insurance lobby, and get this done.
If you take away some of the dress-up game that the insurance lobby did yesterday with this report that they put out, they were essentially admitting, fairly bald-faced, that they will raise premiums under the current reforms as they now stand, having been passed by the Finance Committee. They tried to dress up this threat with these cookbooks that were cookbooks to such a degree that the accountants who got them the raw numbers admitted they were cooked and sort of stepped away from the final product. But there was a threat in there nonetheless from the insurance companies. Pass this, we will raise your premiums, whether it's the necessity of nature causing this to happen or just their own greed causing it to happen. They're saying it's going to happen. Where is the outrage from the Senate, from the leaders in the administration, to just the concept of a threat by the insurance industry?
I could tell you, Keith, you're going to hear it every day from this point on. It's unacceptable to let the insurance industry call the shots. I mean, to do this study, for example, on the eve of the big vote, I mean, I've been around Washington, D.C., and the fact is, if you've got a checkbook, you can just get about any set of facts you want. But the insurance industry is already shellacking people with these huge premium hikes. We're going to stay at it until we get more competition, until we get real choice. At every rally in this country, the president promises the American people choices like their member of Congress gets, and I'm going to insist on that.
I understand the need to move this bill out of committee in order to fix it after it got out of that sort of hothouse environment. But what do you plan to do if the legislation does not get fixed to your satisfaction and to the public's satisfaction? What if the final bill is reform in name only and it's paid for on the backs of the middle class?
Keith, I can tell you my price is real reform. There is no bauble, there is no piece of pork that is going to persuade me to support the kind of bill you just described. We're going to have to make sure that the American people see that this time it's different. The lobbies have tremendous clout. We all understand it. That study yesterday is just an example. But this time it's going to be different because we're going to stay at it until insurance companies are held accountable and premiums go down.
Can you see any way, theoretically or otherwise, for that to be accomplished without a public option in the final measure?
I never draw lines in the sand, but I can tell you I am going to fight every single day for these choices, public choices and private choices. That's the best way to hold the insurance lobby accountable. That's what they fear. That's why they're spending all this money to try to derail reform.
Senator Rod Wyden of Oregon and the Finance Committee, great thanks once again for your time tonight.
Thank you, Keith.